Hi, my name is Dr. Tony Hall, and today we're here at Malibu Chiropractic with Catherine. Catherine is now done with her relief care plan. A relief care plan can be anywhere from 4 to 6 visits, and basically the purpose of this is to get a person 50 to 75% better. So when they come in with a pain or an injury or suffering of some sort, our first purpose is to get them out of pain and get them feeling better, and them being able to say, I'm 50% better, I'm 75% better, and then if they choose, because at that point, after they have their relief care, after those few visits, I stop and I say, okay, here we are, we're done with what you came in for. Now, in that time period, I educate them on what corrective care is. And corrective care is where we help a patient restore full healthy function. Symptoms stop at about 75 to 80%, meaning if a person can only move their neck 50%, they have numbness and tingling. If they can move it 65%, that's gone, but they just have pain. At 75 to 80%, they're, look, I'm fine, I'm going to go, I'm done with my symptoms. But I educate them that you have to regain full function, 95% plus of your function, to not be atrophying and suffering a permanent loss and getting stuck down in the pain range. Now, Catherine, what is your percentage on your low back pain overall after your relief care?
I'd say
50% better?
I'd say closer to 75 to 80% better.
Okay, so this is not uncommon, but then also we'll notice, Catherine, I take her through the ranges and she's fine, but when she gets down on the table, she's like, oh, I'm still a little achy here. Well, even when you're at those, when you're out of the symptoms, you'll find that some movements can be uncomfortable. So now that she's in corrective care, I'm going to go over here and just explain something real quickly that I explain to the people I recommend corrective care to, is restoring movement that hasn't been used for years. So corrective care is actually where you get the tissue that has only been functioning at 75% for like 5 or 10 years, and then you start to get the surrounding tissue and everything working up to 80%, up to 85%, up to 90%. And when you get above 80%, I found that, especially in spinal injury, that the only way to accomplish this is through chiropractic treatment. And why that is because chiropractors do neuromuscular re-education. They teach the joints of the spine how to work again. That memory has been lost. And through the adjustment and the different techniques that we use, we teach the spine how to work again. And once we teach it how to work again, then it's no longer atrophying, it's no longer degenerating, and you don't get into this pattern of constant pain and stiffness and achiness. Now, my goal for the average person is to restore them to 95% plus of function, because if I found that if the body's going 95%, the tissue, the joints, everything, that it's no longer atrophying, and you can keep that in 5, 10, 20 years, you're still going 95%. It takes a little while to gain that fully back, and that's what corrective care is about. The next thing is with athletes, my specialty is chiropractic sports medicine, and my studies and research are in resistance training and increasing performance in athletes. So my program for athletes is to take them from 120 to 220% of increased function, meaning that, like I told Catherine, that say if an athlete comes in and they can only bench press a certain amount, like maxing after trainers and everybody, only 5 sets of 325 pounds, 5 reps, then through my program, what will happen is that in 6 weeks, they should be doing like 15 reps of 320 pounds, where they were maxed out at that before. They'll do 4 sets of 15, and then they'll be up to 365, and so that's just an example of how I measure 120% to 220% functional increase. Jump higher, reduce risk of injury. So that is my explanation of corrective care and a brief review of relief care, and thank you very much.